Layers of smoke covered the afternoon sky above the Otay Wilderness area in January. The border to wildfire was growing quickly. It worried one of Dr. Rajat Zuri's patients who has asthma. She didn't live in an evacuation zone, but it was
close enough that her health was threatened.
Zuri is her pulmonologist at UC San Diego. He says people with respiratory conditions like asthma and chronic obstructive pulmonary disease, or COPD, know smoke is dangerous for them.
That she would just immediately pack up and drive a few hours to stay with family until the fire would end. And just like how disruptive that is to folks on a day-to-day basis that are living with severe COPD or asthma.
Parts of California are experiencing fire conditions twice as often as they did more than 50 years ago, and the risk is expected to worsen as the climate changes. Zuri is concerned about how that will impact his patients and the system that cares for them.
It's going to be a reality that we're going to have to plan for it to actually be able to accommodate patients in those regards.
A new study shows how wildfire smoke may lead to hundreds more deaths each year in San Diego County by 2050. Carlos Gold is a co-author of the study and an assistant professor at UC San Diego. He says a pressing question for many is
understanding the expected health impacts from wildfire activity now and in the future.
He says San Diego County could experience up to 590 excess deaths per year by 2050. That's about 400 more deaths a year than today.
Even though we have relatively little smoke, when we are exposed, we do face health consequences.
Marshall Burke is another co-author of the study and a professor at Stanford University. He says San Diego has less smoke than other parts of California because
San Diego, in some sense, is in a lucky spot. It's by the coast, and a lot of times the wind blows from the coast inland.
He says fire is not new to San Diego.
But in terms of smoke exposure, San Diego has gotten away with a bit less exposure than many other parts of California.
But when wildfire smoke increases, like it did in 2007 and 2020, so do asthma rates and deaths. Burke helped create an interactive map that illustrates that data. He looks at the map for 2020 in San Diego County.
But this is really trying to measure, okay, we're getting more and more extreme days. On the really bad days, what's likely happening?
It shows how many extra people went to the emergency room.
And there we get a 60% increase on the single worst day.
Wildfires can expose people to toxic microscopic particles known as fine particulate matter for days or even weeks.
These are really, really small particles. 1/30th the width of a human hair is the way we think about it.
These particles can get deep into your lungs, enter your bloodstream, and have a cascading effect on your health.
And what we know about these various pollutants is that exposure to them can lead to increased risk of cardiovascular disease, specifically with coronary artery disease, worse outcomes with COPD.
Researchers say there's an urgent need for wildfire smoke adaptation. That could include prescribed burns to keep dry brush from becoming fuel for future fires. The study shows these worst-case scenarios can happen if the world warms even just 2 degrees Celsius more. Gold says their findings are forecasts.
So they aren't telling the future. We have a role in shaping our own future.
Tammy Murga, KPBS News.